Welcome to OSCE videos for NMC Part 2 exam prepared by USSCN.com. Like, share and support us for more videos. In this video, we are going to discuss about ANTT, which is also known as Aseptic Non Touch Technique, which is used for wound dressing. So as for every procedure, you need to do the scene safety checking when you're entering the room. Next, you need to do a hand rub using the 7 steps of hand hygiene, and you need to introduce yourself as an attending nurse. So remember, first the scene safety, then the hand rub, and next one is introducing yourself as a nurse. The next thing you are going to do is identifying the patient. You ask the patient what is their name and what is their date of birth, and you need to confirm the same with the ID band. You should also ask them what you like to be called, because different patients will like to call something else than what their name is. So you need to ask what you like to be called of. Next, you need to state your purpose of visit, that is ANTT, that is for wound dressing, and you should gain the consent for the same. After that, you need to protect the privacy and dignity of the patient by putting on the curtains, closing the doors, and putting on the blinds. Next, you have to ask for allergies for adhesives, plasters, bandages, or latex, because after dressing you will be putting an adhesive plaster or the bandage you have got, as mentioned in the scenario. So it's necessary to ask the patient before whether they have any allergies for adhesive, plasters, bandage or latex. Next, you need to ask for any pain. If there is pain, you need to use the pain score and ask if the patient requires any medication. This is very important for the wound dressing procedure. So, after confirming that the patient has no pain or asking that if they do need any medications, you need to use the hand rub and put on a clean gloves. Remember, when you are doing hand rub, try to do it in the proper way, following the 7 steps. Then you need to inspect the wound and linen, and you should state that the wound is clean and dry and the linen is not dirty, so there is no need to change the linen. Now, after checking the wound, you need to verbalize that you are going to assemble the articles for wound care, and tell the patient that you will be around, and if you need anything, just call me. Now you need to do a hand washing at the wash basin using the 7 steps of hand hygiene. So there will be a wash basin. You need to do a hand wash. You need to do a hand wash in the proper technique of following the 7 steps of hand hygiene. Next, you need to wear an apron and a gloves and confirm with the examiner whether the trolley is cleaned with the soap and water in past 24 hours. So wear an apron and the gloves and confirm with the examiner whether the trolley is cleaned with soap and water for past 24 hours. Now you need to clean the trolley with the alcohol wipes for 30 seconds and wait for another 30 seconds to dry. So you do not have to wait for 30 seconds literally. You can ask the examiner to confirm whether the trolley is cleaned with alcohol, whether the trolley is clean and dry. Now you have to remove the gloves and apron and perform a hand rub. While cleaning the trolley, you need to do it from farther to the nearer end and from top to the bottom shelf. This is very important. And the top shelf of the trolley you should consider as sterile. You should not touch the top part of the trolley when you are moving the trolley from your side to the patient side. This is very important. Now you are going to assemble the things for the ANTT procedure, and you need to keep all the things under the in the bottom trolley. The things you need includes for dressing for your purpose, means not directly related to dressing, and includes some other points. For dressing as such, you need a dressing pack, a saline sachet, alcohol swabs, and a bandage for the dressing. For your use, you need to ensure that there is a clean glove pack, hand rub, and some extra aprons. If your palm size is more than normal, that is above 6 and 7 glove sizes, you need to keep some extra sterile gloves for your use. You need to make sure that the dressing pack, the saline sachet, the alcohol swabs, the dressing or the bandage, the glove pack, the hand rub, and whatever you are using should be within the expiry date. You need to check that, and you need to verbalize that. That is, you need to ensure you check the expiry date of everything you take and make sure that there is no precipitate in saline and sterile water sachet, and you need to verbalize that. Next, you need to put an apron and go to the patient side. This is important because you will get time before the procedure to check the dressing set that is kept for the exam. Usually the dressing set kept in the exam center will not contain an apron. So make sure that you put the apron and go to the patient side. While moving the trolley, you should make sure that you are not touching the top part and you are holding the below part of the trolley. Then when you come to near the patient, you need to verbalize that I am back and I need to check your dressing and you to loosen your all dressing. So you have to wear a gloves after a hand rub and loosen the all dressings without taking it out. Then you need to remove the gloves and do a hand rubbing. Now you are going to open the dressing pack. So open the pack without touching inside onto the top part of the trolley. After opening without touching inside of the dressing pack, you will get a cover inside the dressing set. Use this cover as a gloves on your dominant hand and separate the things inside the pack so that it is not mixed together. There will be a small tray, a plastic one, inside the dressing pack. Please keep it on the side, not in the center. And there will be tissue for wiping the wound. And there will be a pair of gloves and a drape. Do not remove the cover which you are using as a gloves and use the same gloves to remove the old dressing and turn it inside out after grabbing the dressing. Then you need to stick the bag to the lower side of the trolley. Then you need to do a hand rub and take out the sterile water or saline sachet. You need to open an alcohol wipe and wipe it for 30 seconds and allow it to dry for another 30 seconds. As told earlier, you can confirm the same with the examiner that it is clean and dry. After the examiner states that it's clean and dry, you can go on opening the sachet and pour the saline or sterile water to the tray inside the dressing set. Now we need to do a hand rub and open the bandage and put it inside the dressing set. You should make sure that the bandage is not getting unsterile while you are putting inside the dressing set. Open extra gloves if you request that inside the dressing set. Now you do need to do a hand rub, then wear the gloves in the sterile technique. I mean the sterile gloves that is kept inside your dressing bag. You should know that after wearing the gloves, the next thing you need to do is to put the drape beneath the wound in a sterile manner so that you are not making your gloves unsterile. Now, it is another key point that you need to tell the examiner that you will consider one hand as dirty hand and other as clean hand. It is advised that you use your dominant hand as the clean hand and the non-dominant one as the dirty hand. Now you need to take the tissue to clean the wound, dry it and leave it moist. Ensure that you are using only dirty hand to clean the wound. It can be done in such a way that you are taking the tissue with your clean hand, you are soaking it, squeezing it, wiping on the wound, and after passing it to the dirty hand. Don't overdo the cleaning because it will affect the healing of the wound. You need to verbalize this. It's advised you only use 1 or 2 or maximum 3 wipes for cleaning the wound. After cleaning the wound, you need to state the wound condition. If it is a surgical wound, you should tell that the wound is clean and the sutures are intact to the examiner. Then you need to take the bandage which you have already opened in the dressing set with your clean hand and make it half opened with your clean hand. Then you need to put the dressing on the wound with your clean hand and stick it with minimal assistance from the dirty hand. Then you need to remove the drape you had put first beneath the patient's wound site. Then you need to verbalize to the patient that the dressing is over and you are taking out the drapes and everything. You should verbalize the patient that I am discarding everything in the clinical waste and I will come back. You need to move your trolley near the clinical waste and discard all the used items in the clinical waste. Now you do need to do a hand rub and come back to the patient. Give the call bell to the patient and tell that you will be around for another 30 minutes. And please press the bell so that you can come in case of any adverse reaction. Then you will tell the patient that I am going to document and leave the room. Then you need to at least verbalize that you will document the condition of the wound and the surgical dressing was done using the ANTT technique with the date, time and signature. Don't forget to open the curtains and blinds. Do a hand wash, possibly in wash basin, before leaving the room. The key steps you should never forget in ANTT includes patient identification, hand washing using 7 steps of hand hygiene, the clean and the dirty hand after opening the dressing set, sterile technique as far as possible, discarding of waste in the clinical waste bin provided, sterile gloving technique, stating the wound condition, providing privacy to the patient, and pain scoring. So that's all about ANTT. Please don't forget to subscribe to our YouTube channel nurseshere.com for OSCE videos. We are specially preparing for NMC Part 2. More videos are coming. Please subscribe our channel for future updates. Thank you.